Time for our visit with Dr. K. Dr. Kevin Kavanagh is a retired physician and also founder of Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
Great news today, man. The Pfizer product, the vaccine that Pfizer's putting out, has been approved in the United Kingdom. Now, the question next would be, when are we going to get that opportunity?
Well, I'm not sure. Waiting for the FDA, which should meet in a week or so, and we'll get our doses right after that. Of course, the problem with another country approving first is that if you're Pfizer, you may be selling them your product first, which could decrease the amount of doses. I really do think there's going to be, at least initially, a competition for the vaccine. In the United States, I hope that continues. I hope we don't have a big anti-vax movement. But nevertheless, who gets the vaccine first is of utmost importance, and I think we'll see that discussed extensively in the media and lay press.
Yeah. So what is in the news this morning regarding the coronavirus? Anything additionally we need to know?
Well, I would think two items. One is the CDC had an advisory committee on immunization practices, which met, and they've decided that the first people who will receive the vaccine are going to be healthcare workers and nursing home residents. That's really not that surprising. There was some discussion regarding nursing home residents because initially there was fear that, well, the vaccine may not be shown to be effective in that age group. Similar to the flu vaccine, maybe you need a larger dose. Well, guess what? Over 90% effective in that category. This vaccine really works far beyond any expectations. So they were moved up front, whereby the idea here is to prevent death, not so much to contain spread. If you wanted to prioritize containing spread, you would have looked at frontline workers such as grocery workers. However, this vaccine has not been shown yet to be effective in preventing spread. And what I mean is, we know it prevents severe disease, almost 100% from severely getting sick. Some reports say 100%, but I'll be honest with you, in my book, nothing's 100% in medicine.
Yeah.
But grocery workers, let's say they get the vaccine, they won't get severely sick, but maybe they're just asymptomatic carriers at that point. In other words, maybe it gives you a mild infection, you don't know you have it, and you can spread the virus. That hasn't been determined yet. But of course, if everybody gets the vaccine, the infections will go away, the hospitalizations will go away, and the epidemic potentially could burn out. So I do encourage everybody to get the vaccine. The other item which I have seen in the news report, and I think this is probably problematic, is reported by the Courier-Journal that 40 restaurant owners formed a group called the Kentucky Restaurant Rescue Coalition. And on December 14th, with or without the governor's okay, they're planning to open, which I believe is at a 50% capacity. Now,
I read that.
Yeah. And Jack, I feel for these guys. I mean, they're in a terrible position. Look, I've been through this. As a physician, I was a surgeon. I felt I was a good surgeon. And then I developed arthritis. I had to quit my practice. And at the time I did that, and this was because of the arthritis, I had no guarantee of any economic safety net, but I had to do it for the safety of patients. And so I think we need to look at the safety of their customers. They need to realize that if they do this, they will be doing it at probably one of the peaks of the Thanksgiving fiasco that we've seen of people going around and spreading the virus. We're still going to be at a peak spread time. This may cost lives. And I'm worried that as the toll of the public really mounts, there may be a backlash against individuals that are not following good public health guidance. Believe me, I would much rather be like Australia, where if we were doing as good as they were, adjusted for population, we'd have about 12,000, 13,000 deaths, or South Korea. Again, if we were doing as good as they were doing, adjusted for population, we would have approximately 3,500 deaths. So we are not doing good at all, and it's all within our hands and our control. So we do need to, at least during this time period of peaking, to follow public health advice. Keep safe. The light is at the end of the tunnel. The vaccines are being produced, and we should be able to get out of this if we all work together and care about one another.
Amen, brother. Hey, thank you, Dr. Kavanagh. I'll talk to you Friday.
Thank you, sir.